So, good evening, friends. Welcome to our monthly academic webinar conducted by Department of PMR, SVNIRTAR under the aegis of IAPMR and Odisha Association of PMR. Today's discussion is something different and special. Friends, as you all know, as per the earlier NMC Act, PMR department was mandatory for all medical colleges. Of course, currently it is not. Accordingly, many state medical colleges started establishing PMR department. Fortunately, all AIIMS are also having PMR departments as they are regulated by Special Parliament Act, although they are still struggling for the faculties. Most of the new PMR departments facing the crisis of resource faculty and departments are headed by junior faculties. Although senior faculties of other departments such as medicine, surgery, orthopedics, they are made in charges, but they hardly show any interest in the development of the department. Therefore, it is the junior faculty who has to take all the burden for the growth and development of the department. They used to face a lot of challenges. This is now a day-to-day problem for almost all of the most of the PMR departments of the country. What are those problems? What are the challenges faced by our juniors or difficulties in establishing a PMR department? For discussion regarding these issues, today we have with us one of the eminent physiatrists who has vast experience of starting a new PMR department in AIIMS Patna, who has gone through all the hurdles and burdens and challenges to establish a successful PMR department. He is none other than Professor Dr. Sanjay Pandey. He is the professor and HOD of PMR, AIIMS Patna. He has special interest in spinal cord injury rehabilitation, rheumatology rehabilitation, neuro rehabilitation, and research, and especially different administrative activities. He has lot of credit and awards to his credit, such as KK Memorial Awards, ABPMJY Award, this is Chikitsa Sanman Award, Corona Warrior Award, and he has 52 publications to his credit, and he has achieved 3 extramural projects. So Dr. Pandey, he has a vast experience. He has gone through all struggles. He knows that what are the problems one can face during starting a PMR department. This is happening everywhere, every medical colleges. So especially our the strength of faculties, and we all medical, they are struggling for the faculties. Wherever mostly the junior faculties are taking over the charge, and really they are facing a lot of problem. So how to go ahead, how to manage these problems, how to successful establish a department, overcome all these hurdles. Today we will discuss one by one, especially touching every points. We'll try to touch every points, and this is not a formal presentation in this webinar. As I said, this is special, something different. So all the participants are requested to actively participate, ask their queries, what are the problems they are facing in their departments. Dr. Pandey will be here, he will explain you, he will give you suggestions, and also we invite suggestions from the all audiences or whoever is joining the webinar. I don't want to waste much of the time. Let us invite Professor Dr. Sanjay Pandey for his expert opinion regarding establishing PMR department in any of the academic institution. Over to Professor Pandey.
Thank you so much, Dr. Pabitra Sahoo. First of all, I must thank you and congratulate you at the same time. Thank you for giving me this opportunity to address this our IAPMR members through this webinar. And congratulations for conducting it so successfully along so many, in fact, 1 or 2 years. And we officially acknowledge.
No, it's 5 years.
Yeah,
it started in the Corona period.
Pardon me.
It's around reaching to 5 years.
5 years. So coming to the topic, actually the title of the topic itself explains so much, this strategic planning and leadership. So I am not considered myself as a leader, but I will share my experience regarding everything, whatever written here. So just as a customary, to start with a definition. So if we go with the definition, then what is strategy? So in my view, or what I can think, strategy basically it is a plan that you use in order to achieve something or plan to do or achieve something that is very important to you, and that is go with the vision of your institute as well as your department. So coming with this strategy and administration. Administration, we all know what is administration. Administration has several meaning, but at its core, it involves an act of managing, involves the act of managing and directing affairs. Here is a breakdown of common understanding, general management and everything. But Dr. Sahu, can you tell me what the first thing you discussed?
Yeah, so
Establishing a department.
basically, we'll discuss how to establish a new department.
Okay.
So we'll go one by one. The basic part to start a department is just to have manpower. You know, this manpower is definitely it's a basically administrative procedure that what manpower is provided to you. Different medical college, they have different structures. Like AIIMS, you have one professor, one associate professor, one assistant professor to start with. So this all medical colleges are not that much of lucky to start with have a professor. So mostly it's a junior faculty who will have to handle these things. So how to go ahead with how to plan to give proposal to the administration that yes, you need manpower, not only the faculties, also the other ancillary manpowers, like you have sisters, you need paramedics like physiotherapists, occupation therapists, and other administrative staff to successfully run a department. So can you give put some lights on that what manpower and how to give a proposal for a manpower?
Okay, I will begin with the very beginning, first step. Suppose as a new faculty, anyone going for joining the department, the first thing, you have an appointment letter with you. You are going there and reporting to the director or the dean or the DDA, whichever office is empowered to let you join. You go there, submit your joining. I'm telling very basic thing. So if senior people are here, so please don't get offended. The very basic thing I am trying to explain with my experience. And after your joining, the director or whoever is there in charge or MS, he will direct you to go to your department if it exists there at all. In many AIIMS, there is no provision for the department there in the master plan. The older AIIMS or the first generation of new AIIMS they are fortunate in this aspect. They have a department earmarked for the PM as a PM&R department, and it was there. Whenever you go and sit there, and if there is no department, you will be allocated a space. You go there and occupy that space from day one. Okay. And after the space occupation, and if there is no space and nobody is even allotting you a space, you go and sit in the director chamber or MS chamber and do it daily, regularly, till 9, till 5. Start from 9 until 5. Within a day or 2 or 3, you will be given a space. If you start doing this, director, MS, or whoever is sitting there, he is forced to give you a space, because if there is no space, you are going to sit there. Once you get in a space, you will ask for basic things, like most likely it is there by default. I am just reiterating it if it is not there. That is the basic thing, like a table, chair, computer, printer, everything. You start making a file, the file for establishing your department. And why you want to establish the department, or why any department is getting established in a medical college. My talk is basically from the AIIMS perspective. A department is designated to provide few services. Okay. Be it clinical, be it academic, be it research. In clinical, you have OPD and IPD. And as you have no space, or most of the department starting just like you, they will start with the OPD. So everybody is making a file. You also start making a file with the title to start OPD clinical services in the Department of PMR at this institute. And there will be a list of requirements from your side to be put up in front of administration. And the list will encompass broadly 3 categories: the manpower, as Dr. Sahu has suggested, the space, and the equipment. Okay. But it's not like that you will go in one go. Okay. You can start in a phase-wise manner. The basic OPD clinical services that involves consultation, and the few services like therapeutic services involves the physical therapy services, occupational therapy services, and prosthetic orthotic services. But most of the time, they will go with the physical therapy services first. So you have a space, you have a manpower, whatever you will demand, that will be as per the sanctioned manpower list that you have to download from your institute website. And it has a sanctioned manpower list in the Department of Physical Medicine and Rehabilitation, like how many faculty they have sanctioned. Usually 3. One is professor, and one is associate professor, and one is assistant, or 2 assistant professor, 1 professor, and 1 is associate. Okay, just like that. And there are few category under which they have provided the manpower, like physical therapy services, occupational therapy services, prosthetic and orthotic technicians. You will ask for that. And third is basic equipments. Okay, you start with, like, you all know this therapy, but how to have this manpower recruited. For that, again, you have to make a file. So there are a number of files need to be initiated. All these files need to be moved separately, not in one go. A space you have, earmarked space for you have. Even for future vision, the space you can provide to the administration. And like this space limit. No, don't need to go for any MSR document. It's not like that. If you download any MSR document from the NMC from here and there, you will get that space. You create your own space as per ideal space. If you have no idea at all what space, how much space I should want, you ask other colleague who are working other department, or in your own colleague who are working in your own institute, like medicine colleague, how much space they are requiring for the consultant, how much space requiring for this, and you must require the gym space. Manpower space you have to provide with justification. Like you are starting OPD services. In OPD services, what are you plan to give? Like only this consultation, or the specialty clinic services, or this what do you call the minor procedure services. Once you start this minor procedure services, then again you will ask for the nursing officer support. There will be nursing officers will be also provided to you to start this mining services. Again, at the reception side, you need one this data entry operator, one to this OPD manager, and one is this to do the billing and everything. It will be provided by AIIMS everywhere. Next, regarding this administration thing or strategic planning thing, most of the time you will be asked by your administration, just like any other specialty in your institute, to present a presentation for your department. This is usually within a month of joining your new institute. Director will invite you to make a presentation. That presentation is going to happen with all the top administrators sitting there. So this is very important step. Just keep that in mind, and in fact, prepare it from beforehand, not just after the intimation of the notice. You have 3 broad outline of presentation. The short vision, mission, goal. What is your vision? That is where you want to see your department in next 5 years or 3 years. Okay. Mission. What is your missions? Missions, all the services will be included there. Like you want to have this OPD services, you want to start this IPD services, and you also want to start this PG teaching at your department and certain specialty clinicals. And goal is to make your this department as a center of excellence, or whatever you think you can be in based on the area of expertise and interest. So this equipment list you will get from other AIIMS or other established institute, and our PM&R specialty is so much helpful. Everybody will share with you with this list. And the how to procure this equipment we will cover under the procurement, I think. Yes, Dr. Sahoo.
Yes, yes.
This equipment thing will consider in the procurement. Now, is there any other point after that?
Yes.
After equipment, what we have? Services. Okay. Coming to the services. Starting the services and getting the patients. Initially, you will have to face a lot of struggle just to get the patients to your OPD. Believe me, this is very fact. Whatever fancy world we are living in and whatever thought we have in our mind that the patient will start flooding your department, this is not going to happen. You have to fight for the patient first. Okay, it will go. This fighting will go for a few years. It's not few months. If you are lucky, within few years, you will get a large number of footfall in your department. So how to get patient? Unless until you show your patient in your department, in your OPD, you will not able to reflect your workload to your administration. Unless you don't have any workload, administration is not going to support your any demand. So how to increase your demand? By making friendship with other, because you have a lot of time. Don't waste this time sitting in front of the computer and sitting in your room and believing that you will get every patient. No, you have to visit other departments. That's what I did. Actually, I told in the very first time, I am sharing my experience. So please, anybody don't take it otherwise. Okay, you make friend with other colleagues, other department. Most friendly department is the general medicine, the general medicine, the dermatology, the obs and gynae, and this psychiatry, later on pediatrics, neurology, neurosurgery, in fact, much more friendly, trauma and emergency, and also orthopedics. In our presentation, what we did at AIIMS Patna, I was single there for last almost 10 to 11 years. Luckily, I have 2 more faculty with me right now. So we did a presentation to all the departments. The department was how the department of PMR can be helpful to institute like AIIMS. This was my first presentation in the year 2013, that is 12 years back. And my first slide was to rehabilitation of obs and gynae patient. Rehabilitation in obs and gynecological, how PMR will help in the obs and gynae department. That was my first slide. Intentionally make obs and gynae slide as my first slide. So you start making friends, let them understand the how you can help them. It's not like that we are going to treat the patient. Actually, what I did actually, not I'm going to treat the patient. Actually, I want to help your patient because you want your patient every good for him, but better for him. So slowly start making the friends. They will start sending their patient, their relatives, even also engage staffs. Those staff sitting at the OPD registration desk, they also must be aware about the PMR, because whenever patient is coming to OPD registration desk, that is the first place where a patient visit in any institute. So OPD registration desk clerk, he must know what you do in your department. There are many ways to, again, he will also face a lot of resistance because other department might go to that clerk. In fact, why you have sent this patient to PMR? These patients are supposed to be treated by our department. You have sent this patient, so you are doing wrong. Don't do it, otherwise we will complain you. Okay. So don't bother about those complaints and don't go for fight with them. Okay. Slowly and slowly, they will also learn. Okay. Like if a patient is having this problem of knee pain, okay, and he's coming to your department for therapy, but as a consultant, you are seeing the patient first before sending him to the therapy room. What we used to say at our day, as you have visited orthopedics department and other department, do you need any surgery for that? Have they advised any surgery or want to knee replacement? Patient will tell you, no, sir, they have prescribed me medicine and asked me to go through for therapy services. That's why I come here. Okay, no problem. You follow advice there as per the advice given to you. But the therapeutic part will be taken care by us. Okay. In the first prescription, don't override, don't prescribe your drug, let them have their own drug. But in the follow-up, you must suggest to your patient, you must visit our department because this part will be only taken care by us. But if you have any surgical need, then you can also go to that. Slowly, patient will understand who is treating him. And he will, again, no need to go anywhere. He will directly come to you. It will happen with each and every patient. But treat him gentle, very politely, very, as you all know, we all did very, like history taking is the best part in the PMR. Nobody can take history like PMR. And the clinical examination, we all are expert. So the patient is very much satisfied and he will spread the word. Again, any day, like, actually I'm talking about how to get the patient. This is the point. Any day, don't waste a single day, like arthritis day, okay, like cerebral palsy day, like most of the 3rd December. That is the best day for us. And we have proven it's so worthy for our department. We celebrated that day in a grand style every year till date. So everybody will know what kind of patient you are dealing with. The administration has started to come to visit your department. The director will come, the entire administration will come to your department. And whenever they will come to your department, they will see what you are doing and they will support you. So now you are getting the patient again. Now how to start IPD? Because IPD getting bed is difficult. Initially, they have only 100 beds or 50 bed ready. The entire institute is under the construction. So how can I give bed to the PMR? This is the last, this in our priority. Okay, why you want bed basically? So you have to tell them, sir, basically the patient are coming from far-flung area, even the pediatric patient. They cannot afford coming and going every day. And from far-flung area having an economical burden to them. So we need to admit them, even for therapeutic purposes, even the low back patient, any patient. So they will offer you bed, not by the name of PMR. You can admit your patient on any other department with the consultation and consent from that HOD if beds are available. Now what is happening? You are starting admitting your patient, be it intra-articular knee injection you are giving, shoulder injection giving, suprascapular nerve block you are doing, adhesive capillary exercise you are doing for 7 days, even physical modality you are giving for 7 days. But even for 7 days, patient need to be admitted. I don't want patient to come and go. slowly you have a built up of IPD cases that you have admitted, and the administration will see in the reflected data that PMR is admitting the patient regularly in various wards. Now, their HOD will be very much concerned that you are occupying their bed and they are not able to admit their patient. They will create a situation to you. Again, you will force to go to director or MS, and again you convince them, sir, actually we need our bed, because a lot of problem happening with other department. Most of the time they have their own patient. Where will our patient will go? And you can see how much patient we are serving through our IPD services. Then they will allot you few beds. And as per this master plan of your institute, you have 30 bed allocated to you, and later on you will get all these 30 bedded. Initially, you have many rooms. Once the this OPD block or IPD block will be completed, you have a department there. Okay. They will ask what is the name of your department. Okay. For signage purposes. Never say like my department, I want to this Bhautik Chikitsa and Punarvas. That is my belief. Okay. You don't have to follow this. Okay. I use my signage as a PMR department, and my building is PMR building, not physical medicine and rehabilitation, not Bhautik Chikitsa and Punarvas, simple PMR building. My department is known as a PMR, so my department should be named as PMR in every map of this institute. And then there will be a problem of lot of room will be given to you. And you are the single person who is sitting in your department, and everybody coming to your department can see lots of vacant room are there. So you will be asked or forced to this lease out these rooms or just surrender these rooms to other department, because you have lots of room and no use. You have lots of room, you have no one to occupy that. So this is also an art to how to occupy your space without the available manpower. Okay, so you have to name many services, okay, with the permission from your administration. Like what we did, like counseling room, what we did like this checkout clinic, what we did like this therapeutic exercise demonstration room, okay, PG teaching room, many rooms are there. I was single, how can I occupy so much room? But I know in the future I will get the faculty, and at that time nobody will ready to vacate my own room, which I have given to them. So keep occupying those rooms. You can and the one more thing, you must start this specialty clinic at the earliest. When everybody will get this feeling, they need to start earliest specialty clinic. Then they will tell you why you are starting this neurodevelopmental clinic. This clinic need to be started by the pediatrics. Why are you starting this low back pain clinic? We will take care of that. Neurology will take care of that. Before they get this hint, you start before it. Your proposal will go to the administration first. And administration, once okayed, you can start all these specialty clinic. If they create a problem, just add rehabilitation. Like not low back pain clinic, okay? Low back pain rehabilitation. Rehabilitation nobody is going to do. Rehabilitation PMR will do. Like neurodevelopment clinic. Here not much problem. Rheumatology rehabilitation. Okay. Slowly you will have this OPD, IPD, manpower, space, and everything. Services you have started. After 1 or 2 years, when the third batch of professional MBBS will be there, okay, they will start ask PG proposal. That is also in your vision, PG proposal. So you have to submit a MD PMR proposal along with all other department to the administration. Yeah, academic and teaching, yes, correct. And before that, in MBBS teaching, you have to ask and go to the dean to give you some lectures. They will ask, is there any precedence that any other AIIMS engaged in this MBBS teaching? You can ask from other AIIMS, they will support you with their documentary evidence. If there is no support you are getting, just you tell them, yes, sir, this rehabilitation part, we have to tell. Even if rehabilitation is very important, you can stress upon the need of that. And if they don't give this this vertical, this classes, then horizontal classes you can take with the consent of the other department. Like orthopedics, you can go and ask the HOD, okay, sir, in orthopedics teaching, I want to have this 1 or 2 classes for this amputee rehabilitation and something like that. They will happily have
This
it.
inter-department collaboration is very important. See, these juniors, whoever is joining in a department or like starting new department, new medical colleges here, old established medical college, state medical college I'm talking of. Probably your talk is basically from the AIIMS, but we have to think in all the way to the state medical colleges as well. So till the these faculties, whenever that till then they were students, PG students under the umbrella of the HOD, or senior student under umbrella of senior faculty. They have not faced that type of problems, and they have never thought of these problems also that they will face sometimes in their career. So once they are joining to a department, and especially new department, whether in a state medical colleges even, they are struggling first is to get the recognition. What is a PMR? You won't believe that many medical colleges, state medical colleges, the faculties are even now also not aware about the PMR. So the first challenge to be faced by a junior faculty in a new department in a old medical college is getting a recognition. So that how to avoid these problems, how to collaborate with other departments to startly feeding in their mind that yes, there is a PMR department and it's their role, how they can help in a comprehensive management of their people, their patients. So can you put some light on that?
Sure. Actually, this is not only for AIIMS. Interdepartment collaboration is very important. Okay, as you are newer there, and as you are telling, most of the department don't have an idea what is PMR is. So how to let them know? Believe me, 60% are intentionally ignorant about what is PMR. Nowadays, it is not like that. They don't know what is PMR. Mostly know PMR, but intentionally ignorance from their side. But anyway, we will take as it is. They don't know about the PMR. So you have to engage in various activities. Unless until you do engage in certain activity, either by the organizing department, might be orthopedics is organizing an event, as you said, the interdepartmental collaboration. So you have to approach. Here, not like that you are sitting in your room and you are expecting other department to come to you and ask you, how do I can help you? You are seeking help, dear help. So you have to go to them, not once, thrice, or 4 times, or 10 times. Forget about your ego, forget about your this I don't say use what exactly respect, but pseudo respect. You go there, na? You just go there and talk to them. They all are doctors. It's not like that they are this anti-PMR people. They all are doctors. Just let them believe that you are there to help their patient. Okay, once they believe you are not their this rival, okay, and you are not going to harm their department or their interest in any way, they will help you. Believe me, Dr. Sahoo, they will help you and engage in their academic activity. You volunteer yourself. It's okay, sir. I just came to know that you are organizing this event. I want to talk about this topic. Nobody will stop. How can anybody stop in a medical college? Anybody approaching that I
Yes,
want.
exactly that point I would highlight here, that all juniors, senior residents, PG students, they should start keeping their records, their successful cases in their career. Whatever they have come across with either their teaching period, post-graduation period, or during their senior residency period, they should collect the records of their successful treated cases. May it is a neuro rehabilitation, may it is a rheumatological rehabilitation, may it is a orthopedic related rehabilitation. Keep cases so that you try to collaborate with other departments whenever they are celebrating any day or organizing any academic events. Try to engage with them, present your cases, present your talks, and show your academic activities, what services you have provided, what cases you have shown successfully rehabilitated. That will give a good impact on them, that yes, they are part a neurosurgeon treating it, decompressing a subdural hematoma. Afterwards, how rehabilitation helps in improving the patient, how a rheumatologically complete deformed hand, deformed foot, with the help of splint or other things, how the function can be improved. All these records, recording all these documents are very important to establish yourself as a PMR specialist in a larger forum.
Yes, true. And suppose even if you don't, I am also going much down the ladder. Okay, you don't have a record of successfully treated cases. Okay, no problem. You don't have a record to show how much successfully you are in treating your cases. Okay, but at least you know now what you can do. That there is no confusion about what you can do. Okay, so accordingly, as per the event, suppose like one department I can tell you, you go to cardiology. This cardiac surgeon or cardiologist don't have any problem. Okay, they just want their patient to be occupationally engaged in the life to activity every day. Just tell them I want to cardiac rehabilitation. Start this cardiac rehabilitation services. Cardiac rehabilitation services. So they will send you your patient to cardiac. Pardon. So cardiac rehabilitation. Similarly, pulmonary rehabilitation. Pulmonologist. Lot of cases are there for pulmonary rehabilitation. They will tell you cases. You are no competitor at all with them. Okay. So just dermatology. They have leprosy day and so many days are there. They will send you cases. So Dr. Sahu, I just tell you, I am telling you my experience. We can go also down the ladder and we have to sell ourselves to them for the betterment of the patient, to care of the patient. You understand my point? So there is
Yes,
no problem whether it is AIIMS or state medical colleges, but we need to approach them honestly and
yes,
with a good intention by heart and by body language and by everything, by soul. And believe me, they are doctors, now they are specialists. They very well understand what is in your mind and what you want to do. They will help you. And slowly only we can go ahead with this. So can we go ahead with this academic
yes,
further?
yes, 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 yes.
So once you have this, you must make it a goal. This starting MD at your department, this is one of the most vital step you must concentrate and focused on. Once you start MD, this MD comes to your department. This is the most strong foundation pillar you have just piled out in your department. Okay. So never underestimate the power of MD. Then afterward, nobody can tell this department. This has become the proper part of the your institute. And research. Regarding the research, we all know research is very important, but I am not focusing research here because in the process of establishing the department, you have to sacrifice your publications, you have to sacrifice to some extent your research, but always keep collecting the data, whatever data you can, so that at least afterward, these data can be utilized by you for the purpose of research. And one more thing, getting grant at earlier age is much more easier because there are so many things you can do as a PMR specialist. And in collaborating with other department, they are also looking for the same collaboration so that they can get the grant. So this collaboration in the research with other department will also help you in gaining their confidence and patient also. Can we move to next topic because we have this 33 minutes already spent?
Procurement.
Procurement. Okay, procurement. This is very important. We all know procurement, how much important it is and how difficult it is to some extent. So procurement. Any idea about the procurement? Okay, no problem. I'm not asking for the ideas. How to procure anything for your department, any single item, any item. There are many things you can do for the procurement purposes. One of that is first you have to make a list of that, get it approved. Okay, these are the things you are going to procure for your department. And during the process, there are few things you must do, like make a file. One is this, what you call indent. Everywhere there is an indent form. You first sign the indent, get it NAC from the store, no availability certificate from your store, that this instrument or equipment is not available at certificate. Then there, as per the institution vary, there is a SAC, this standard, this one document certificate they will ask. Then after that, actually it need few signatures, and signature of at least 3% is mandatory. Like one is yours and two other collaborating department. Okay, two other collaborating department, usually na director will tell you in the initial stage you make departmental purchase committee. So you form a departmental purchase committee with friendly departments, like those departments HOD, the department of HOD, those who can understand your need, and they will not create hurdle for you when you are going to your file, let it sign. Like you want to purchase this MSK USG, and if you have kept in this radiology in this departmental purchase committee, then he might to some extent object, or he might to some extent support that he know how what kind of MSK USG better for you. That is depending on your understanding, but there is usually 3 departments are needed, and most of the time even they purchase anything, they need your signature. So it vice versa. Whenever they need your signature, you will also need their signature. So usually it is cooperative. Then you go for a specification. And now either depending on the budget of your instrument, whether it is less than 30 lakhs, 5 lakhs, or more than this 1 crore. 1 crore or 5 crore, something like that. Director has the power of approval 1 crore or 5 crore. More than 5 crore, it will go to the SFC. So a specification, making a specification is very important part, and you must involve yourself in that. Never believe on anybody else, like vendor or whatever they are telling to you or selling to you. You just see which is the best specification by searching on the net or asking your colleagues. And if they have their own experience, they are telling you, I am using this equipment for so many years, it is very good, and it is this and this thing we can do with this instrument, you can go for that. Your colleagues are here important rather than any vendor. And make a specification that is generic, or at least you will get 3 bidders for that specification. If you floated for tender, either on GEM as a custom bid or LTE or open tender, at least you have 3 vendors, prospective vendors in your mind. They will participate in this bid. Otherwise, the whole exercise will be futile. Bid will be automatically cancelled. And again, for the rebidding, you have to go through that. Then will come the this negotiation meeting with the vendor. Okay, like technical specification committee will be there. They will go through the technical detail of a specification, whoever is qualified. Here again, you have to be careful. At least minimum 2 vendors need to be qualified in technical details, technically specify specification details. And after that, there will come the this opening of the tender, and the award will go to the L1 if approved from each and every one. And before that, there might be some negotiation meeting with the vendors. Here you can negotiate with other things that you have forgotten at the time of your making a specification. Like you have asked for a machine, but you don't have a table to keep that machine. If you ask for a thing that need a printing facility and you don't have a printer, if you have asked for a thing that need a computer or monitor, but the machine itself don't come with a computer or monitor. So in your specification, you add these things initially, like you ask a table of this dimension with a drawer, without drawer, you ask a computer, printer, even you can ask for this manpower support for 1 year. Okay, manpower will be provided from them, from their side, without any cost. And one more thing you will keep in your mind, whether there any consumables is involved in that purchase or not. Like you have purchased a machine, but machine comes with a consumables that will recurrently need to be replenished. Okay, like printer need cartridge, many machines need certain things that depending on the machines. So you also include that in tender. Sometimes it is tricky, and always make a comprehensive 5-year CMC in your tender details. So up to at least 2 year this warranty that comes with the purchase, and 5-year next onward. So you have a comprehensive coverage of 7 years. So up to 7 years, you will be very tension free and utilizing that machine for the benefit of the patient. And from day one, utilize that machine and always try to get it inaugurated by the administration. It's not like the machine has come and you have started providing the services. Obviously, you will provide the services, but let the administration feel that they have contributed, and let them feel honored, and let them feel this you have blessed to have their support, and only with their support the machine is there. If possible, put this granite, this stone there with the name of everybody there. Okay, so slowly you are building a relationship. Slowly everybody is visiting your department, and if they are know you are doing marvelous job, and they are providing you space, providing you manpower, providing the equipment. And every event, whatever you are organizing, invite each and everyone, and personally go to their chamber and invite them to come and just bless you. Next, Dr. Sahu.
Proposals.
Yeah, proposals thing. We think I will
Yes,
have to
explain it. Already explained. Center of Excellence
Yeah,
and grants.
yeah, we can skip that. We will come to it if we times permit. This is
Grants.
for the last. Okay, now one more thing I want to tell here. Okay, 2 things we are. I am receiving lots of call. One is regarding RTI. Okay, lots of our people are facing this RTI from the many persons or many institutions. Okay, whenever a RTI is coming to you, I know you all are much more smarter than me, and you know I know you can handle it better. I am just sharing my way to how I handle RTI. Whenever RTI is coming to you, don't go with the word written there. Okay, you have been asked to provide an information only about your place, not even your institute. So don't go overboard to providing information in reply to the RTI. RTI reply is provided by your institute. It's not you are bound to give them, but your institute will forward all these to you, whichever is concerned. Always write like that. In my department this is this, my department this is this, my department this is, or you are always talking about yourself irrespective of RTI, talking about the entire country. Be careful in that, and always try to have advice from other people who have faced similar kind of RTI. And the next, I would like to tell something about now this leadership is not exactly what I would like to this say. Leadership is a different word, but actually you are heading the department, so you can be considered by others as a leader, not by yourself. Don't think yourself as a leader. Never think yourself as a leader. I don't think we should think ourselves as a leader. So what is the purpose of this leadership? Actually, leader is a guide, okay? And you have in your department, many people are there, okay? And everybody know who is heading the department. And every administrator know the department. What we do most of the time, what I feel, we go for the name, okay? Everybody know our name. Wherever anything is happening, our name will be broadcasted and everybody will go, yes, you did it, you did it, you did that. But actually never it happens like that. You always promote your team above than you. Your team members are much more valuable than yourself. Because of only your team, you are able to provide, you have shown them your output. So always respect your team. And even if needed in front of the director or front of the senior administrator, you must name your colleague faculty. No, sir, you are telling it very right, sir. But actually entire event credit must goes to my junior faculty. They have contributed a lot for the success of this. Whenever a director visiting any services, you must praise your nursing officers. They have 24 hours with your patient, immensely contributed to your cause. And always advise, always praise your therapist. Okay. They are what they are expecting. They are only expecting a little bit of respect from you. Forget about what we have with them. You are PMR specialist, they are therapist. Both are doing their job. Okay. There is no need to think about anything. You also want to don't go in that much things, but respect them, accept them, and acknowledge them. It's a team basically. So this is the true leadership, if we call it leadership at all. So now 17 minutes left. Any
And
question?
can you please focus something on how to get research grant? That's very important for all departments of PMR. You know, that's we are lagging this part regarding getting research grant. How to all junior faculty whoever is joining for their promotional purpose also, that's essential. You have already 3 extramural project grant, and how to prepare a project, how to initiate a project, how to ask for a grant, and how to motivate your seniors, your juniors to involve to give a research grant proposal.
Okay, Dr.
That's also
Sahoo.
very important
Yeah,
for
yeah.
every
I will
department.
definitely answer this. Okay, there are two many grants are there. Okay, one is intramural grant, one is extramural grant. For intramural grant, each institute has certain limitations. How many grant they can give to whom they can give to their criteria. Okay, if you fulfill that criteria, you will get that grant. Initially 1 lakh, 2 lakh, something like that. And now this DST, ICMR, and other bodies are there. Even Ministry of Social Justice and Family Welfare also giving. And some what do you say, this from the corporate side grant, some name is, I don't know, I'm just forgetting the name, what to call it, from the
CSR
corporate.
grant,
CSR.
CSR,
So you need
corporate social responsibility.
degree of grant. Like now, one grant we got from this INSKI. Okay, it's not a corporate, but some sort of this grant I can tell you in that kind. So you need to write a letter. Initially, you join the department. There is not much work with you. Okay, and you are just planning and everything. So you need to write many letters to many foundations also, be it Melinda Gates Bill Foundation and other foundation. Sometimes then you need to tell them, okay, regarding the problem statement and what you are going to do. ICMR is a proper structured format. Usually they release this circular like COE, okay, call for this proposal. So you have to vigilant for that, call for the proposal. Whenever there is call for proposal come from the ICMR, there is a list of subject or topic which they want to grant, release the grant. And on any particular subject, you have to select one subject based on your expertise, and if possible, get one PI from other department which have received an ICMR grant. You have to sacrifice your PI purpose here just for the receiving that grant. So don't be greedy. Okay, you are needy here. So approach that person in your institute who has already received an ICMR project. Okay, make him help your proposal, get it passed from your institute and submit it accordingly. Once ICMR see there is a PI which has already received an ICMR grant, it will be easier to get it. And make a very sound proposal. And if possible, get it reviewed from your peers. Okay, everybody will able to add something or do something. So based on the category, now this DST again, DST has certain other criteria. You can approach DST even without this circular. And if you have some merit in your proposal in disability and rehabilitation, in PMR, getting grant for pain is very difficult, it's painful. But this disability and rehabilitation, which we are a specialist, it is easier. And one more thing I would like to add, always start this disability evaluation and certification services at earliest. Okay, don't go away or shy away from this. This is the best foothold you can get with administration. Once you start these services, the entire administration will be felt very much obliged to you, in fact, for only this, that this person has started this, because this is a headache for them.
Yes, we are expecting some discussion from the audience side also, so
Yeah,
that
I
we
am
are
also
not.
expecting. If somebody asks something and share his personal
Arun, can you
experience.
unmute everybody? Arun, hello.
Yes, sir. Yes, sir.
You have
Everyone
muted
can,
everybody. How can they ask question?
sir. They can just unmute themselves and speak, sir, directly.
Okay, they can unmute themselves.
Yes, sir. Yes, sir.
From your side, you have not forcibly mute everybody. No.
No, sir. No, sir. I didn't mute.
Yeah,
So
yeah.
we expect some queries from the participants also.
Because no, look, I am just sharing my experience here, and everybody has so many things to share. This is the basic thing. And this conflict management is also a part of administration, I think. Because no, they're bound to have some conflict with other people. Whenever there is anybody approaching you with any problem at all, though very minor problem, maybe a nursing officer is approaching you, sir, there is some problem with my duty roster. You think, why you are coming to me? This is not my job. You go to your nursing supervisor or somebody else or ANS. Okay, no, don't say like this. You just listen to her or listen to him. Okay, and just ask him. Okay, assure him. Okay, I will talk to your this nursing superintendent. And always don't go for this writing thing. Many times, no, this word of wisdom itself work. And if it is genuine, everybody will know it is a genuine request. Okay, so it happened. And many times, conflict occur between faculty. That is very disastrous thing. Very disastrous thing. Very difficult to deal, because it's not like that you are very much senior and somebody else is junior. Okay, but one thing that we must need to keep in our mind. Actually, we both are here for PMR first. If department is not here, then what is the purpose of our being here? And if we put anyone else in bad light, actually department is getting the bad light. So actually, talk to each other. Basically, no problem in talking to each other. Okay, keep aside your ego. Actually, just see what he is going to talk. If you want to head the department, okay, heading the department is sort of headache also. It's not like that being head of department, you have become a boss. You're not a boss. Actually, you are sitting on that chair to just facilitate the thing. Okay, we all are faculty. One is senior, one is junior, just by the designation or by the year of experience. So just treat it like that. Make him part of decision making. And like anything, any big event you are planning in your department, my way is I go with my point of view first. In a meeting, I never ask anyone to tell what is in your mind. I always tell what is in my mind. Okay. I always say what is in my mind, and I tell them exactly.
So
Ananda
one
Kumar,
problem
please mute yourself.
on behalf of these participants, I would like to ask one more question also. This is a common problem faced by every junior faculty, whoever is starting a department. You might be also facing the same problem of getting the ancillary services. The PMR department, the ancillary services are very much mandatory to give a effective rehabilitation service. Many departments, many medical colleges, they are facing the problem of having an ancillary department. Like you need to have a PO workshop, you need to have a PT department, OT department,
No.
and accessory equipments.
Sorry.
These are
Sorry.
also important part of that.
Look. Sorry to interrupt you. Look, first, let me clarify it. Okay, this is not a problem. Okay, if administration has it, that they can be designated as department. No point is fighting administration. If the administration don't have their designation as department, they cannot make a department. It is very simple as that. Like in AIIMS, there is no such department exist. There are services attached to any department. It will just work like that. They will never go for it. Regarding this unit thing, it's up to you. You want to have an unit, otherwise just name like that. We have what we have named here: electrotherapy room, exercise therapy room, prosthetic and orthotic services. Okay.
That's what I'm asking now. So that ancillary services are very much required. For in AIIMS, it's very easy to get. Maybe for you, it will be easy for you to get all these things. But for a state medical college, really they struggle a lot to have these things. That how to this go ahead with this, that to have these ancillary services to get incorporated into the department.
One phase
That's
you
a
cannot
major
go.
problem for others also.
One phase you cannot go. Like prosthetic and orthotics, we are getting last. What we did, whenever we are writing any, we are prescribing any orthosis or any prosthesis, where the patient goes, they go to outside shop. Shop might be 4 kilometer or 10 kilometer. Okay, slowly it's creating a problem for the AIIMS OPD services for having this patient to check out. Okay, slowly you will go to the administration, you will tell them, sir, we need to have this our own umbrella, because this is very customized thing. When our patient is buying it from the outside, they're buying it at exorbitant prices. The fitting is not like as per the patient, as per the prescription. So why not we must start the department like we are doing amputation. Okay. And for after amputation, we are also accountable for providing the artificial limb, and where they go for the limb. Unless until there is complete artificial limb is provided at our institute and the rehabilitation is training is there, this is not a complete rehabilitation. And we are having the PM&R department. Look, boss, here you need a patience and you need to show the work. And slowly, like I have spent 13 years here. Okay, 13 years, I am just on the verge of getting this prosthetic and orthotic services. Need lot of patience, lot of hard work, lot of perseverance, and lot of this convincing. Okay, no other way out, no other way out. You are telling right, difficult, but they can get it if they just show perseverance, patience, and hard work and dedication. That's all. That is my way of doing it, and this is my solution. That what I am offering to you.
I was expecting a lot of questions from the audience side. So far, I have not received any questions.
Yes, myself, Dr. Sanjay, I am asking the question regarding the procurement. Sir, most of the government institute procure their instrument are procurement done through the government GEM portal.
GEM portal.
So every newer faculty have less knowledge about the GEM portal. So sir, please enlighten this system certain extent. So all the junior faculty will get the knowledge about the GEM portal, how he can procure through their GEM portal.
Yeah, Dr. Sanjay, thank you so much for asking this question. From the very beginning, you're in the institute, there are 2% trained in GEM procurement. One is from the account side and one is from the faculty side. You just need to know who is the faculty in charge for the GEM and who is the account person who is looking after the GEM. You have to approach them, okay? And you tell them, so this is the item available on GEM, I want to purchase. Before that, just you go to the GEM portal, just like Amazon, okay? And type your equipment which you want to need. There are many equipment will come in that list. You shortlist 1 or 2 or 3 of them. And I also take a printout or a screenshot of them. And along with that, you go to the account person or faculty. He will tell you how to get it procured through the GEM. That is initial stage. And later on, department, institute, or hospitals run this GEM training for their faculty. Also participate in those faculty, those training. And you will be slowly. Actually, when you start doing that, you will learn. But initially, you don't know anything, just go to the faculty in charge GEM procurement.
There are other methods also. If the amount is within 25,000, that can be directly purchased on the spot. And if it is within 2.5 lakhs, that can be purchased by the LPC, local purchase committee. With quotations only. Beyond 2.5 lakhs, it's mandatory to go through GEM as per the government order.
Yes.
So you have to have basic knowledge on GEM, or else you can take help of the person who is doing in the purchase section. You can also get some information from them. But it is our duty to prepare the specification. It is no related to purchase section or administration. We'll have to prepare the specification of the equipment that you are planning to purchase. That's sole responsibility is ours.
I can see, actually we have 5 minutes left, but I can see, I hope sir will not mind, but here I can see Professor Gogia is here. Sanjay Vadwa sir is also here. Rajendra Sharma sir is here. We are so blessed. So if any one of them is having wish to just add a request, it's not just they have to add. If you want
Sir, there is a question in the chat box. Can I ask?
Tell me.
There is a question in the chat box.
Yes,
can you read
can read it.
This is question from Dr. Mohit Kishore Srivastav. Sir, if we are preparing an extramural project, what logistic things we can ask funds for? Usually, they don't release funds for investigations. This was the question, sir.
You are this for grant through ICMR or something, some other agency. If you're asking for this ICMR grant, then it will be included, everything will be included in that. Okay. So again, it depends on the type of proposal you are proposing and type of agency which is disbursing. But in ICMR, they disburse everything. It's not like only investigation cost. If this investigation is available at your institute, that you can just quote the price of those investigation in your cost project. Okay, it will be added to that. Even if it's not available at your institute, then there will be a problem, because not they are going to establish your own lab for that. Then you have to show some MOU with other lab, but you have to show them a projected cost of those investigation which you are including your proposal. Like suppose we need a CT scan. So our institute CT scan bin cost this much. We can add that in your proposal, and how much subject it will be needed, and multiply into that, the whole cost will come out.
Thank you, sir. And there is a suggestion from Dr. Naveen. There needs to be a master class on GEM for new AIIMS faculties and other wherever GEM is applicable, or a workshop if possible.
Yeah, we can do that. Many of our own faculty are faculty in charge of GEM portal. So in any of this event of national event, like midterm or be it this national, we can do it. We can have this 40-minute session only for this GEM procurement. We can very well do it. It's a very nice session, and Dr. Naveen himself can take lead in this, and he can contact the scientific committee chairman who is organizing the part, and we will facilitate it.
There's no more questions in the chat box. The sole purpose of this presentation was to sensitize the juniors who are already leading a department, or the senior resident who are going to be posted in a medical college where they are going to start the department. So my sincere request is don't try to sit idle or do of your own. You have to expand your ideas. You have to take help of the seniors, get some ideas, try to expand your department, establish your department, have collaboration with this other departments, show your work to the other people. The situation like that, if you sit idle only looking to the patient, is not good enough. That is not going to solve your problem. So everybody is examining patient, everybody is sitting in the OPD. Beyond OPD, beyond your operation theater, go out of that and spend some times with the other faculties, other departments, and you either you arrange some workshops or webinars or some form of academic events, invite other people of other department, show your department what you are doing, or you also request other people, if they are conducting any academic activities, you try to involve with them, present your cases there, show your department. That's how your department can grow, and it is not sitting idle that somebody else will do for you. We have taken that Hercules task to start the department, to head the department, and accordingly we will have to do that. One more question from the Jimmy Jones. One of the main challenge I faced in private medical college is the lack of insurance coverage of the PMR.
No, it's a very pertinent question, or right question, Dr. Dr. Jimmy. But actually, we need to work on that. Okay, it's not like that I can offer you any solution. We are trying it, and we have tried it in the past also. And
Yes,
now
yes.
you can also come with a proposal to how to make it work. And just how Dr. Sahoo said, expand it, but don't encroach anyone. Okay, you expand, but don't encroach. Okay.
Yes.
You just go open-handed, okay, with honesty, dedication, hard work, perseverance, and very politely. Don't go like threatening anybody, okay? You are not enemy to anyone, but you are friend of each and everyone. Just portray in that manner. Even you are approaching administration, just try to listen to them. Just force yourself to them, okay? Even if you are not prioritizing your this now, if you go repeatedly with 5 or 4 files, 1 or 2 file may be cleared, okay? You have come with 5 requests, okay, no. Each and every request I cannot accept, but they will usually listen to 1 or 2 later. Okay, give me that file. You are coming regularly, or we'll get it cleared. So this is the way I did it. And thank you so much, Dr. Sahoo.
Sir, we have very senior people with us today. Sanjay Wadhwa sir, Naveen Kumar sir, Rajendra Sharma sir. We at least expect some comments from them, that what challenges they have faced, or they want to give any suggestion to the juniors.
Okay, No, I think it's okay. They will definitely always they have helped. In fact, many of times I have asked their help. I have openly asked many times. I have called them whenever I was in trouble. Just like I myself sharing to you. Whenever there is any trouble, you can call your colleague other IAPMS. Many times I have taken their suggestion. I have honestly admired their this help, and really it helped me in getting out of my problem that I can solve. Even Dr. Naveen helped me a lot in many times with disability certification and evaluation. So it's like that now. We are fortunate that we are this closely knit family, and we are working together for the same goal. Right? To have this upliftment of our specialty itself. And always remember, your departmental goal must sync with the institution goal. Your director is nowhere interested in your single department. So whenever you're approaching your director or administration, must keep that in your mind. Whatever you are talking, in some way, it is also valuable for your institution. Unless until institutional goal match with your departmental goal, you will not be alienated. So always talk about the institute first. Like our institute is facing this problem. And in this problem, sir, our department can contribute in making this problem solving problem. Okay, don't go with the problem, basically go with the solution.
Yes.
Okay, Dr. Sahoo.
Yes,
And
thank you very much
and
for
thank you
your
all the
valuable,
participants. You people are listening for 1 hour from my side without any this slide and anything. Just I get talking to you. Thank you so much.
No problem. This was a formal discussion. I was also expecting more questions from the other people, other senior members. Unfortunately, we are not getting any questions. However, the discussion was very fruitful. Some ideas, especially for those who are starting the department, will be definitely helpful. Thank you everybody for joining with us and making this webinar successful. Thank you, Professor Dr. Sanjay Pandey, for accepting our invitation and present a very nice discussion in this webinar. And I must thank the PR team of IAPMR as well as my team members of Odisha Association of PMR as well as my department SVNIRTAR for constantly organizing this webinar monthly since last 5 years. And I must thank everybody supporting us and joining this webinar for academic interest. Thank you very much.
Thank you so much. I'm taking exit from with your permission.
Thank you.